Hello, my name is Alva Lankary. I am an Econ 211 student at the University of the Bahamas, and this presentation is for that class. Economic impact of COVID-19 on the Bahamas. Before the pandemic of COVID-19, the COVID-19 pandemic, the Bahamas was overcoming the effects of Hurricane Dorian, a Category 5 hurricane which hit Grand Bahama and Abaco in September 2019 and resulted in damages and losses reaching about 3.4 billion. COVID has caused a sudden stop in our economy and tourism. What is COVID-19? COVID-19 is a disease caused by a virus called SARS-CoV-2. COVID-19 can be severe and has caused millions of deaths around the world, as well as lasting health problems in some who have survived the illness. We have seen COVID-19 spread over the entire world, causing mass destruction in economies, social lifestyle, and the like. In this presentation, I would attempt or I would look at several areas that are impacted by COVID-19. The areas that I will look at are healthcare, tourism, unemployment, educational, social impact, technology, government, and economy. Healthcare. There have been several challenges in combating COVID-19 in our healthcare system. We find that the Bahamas already having a limited healthcare system, that it was actually strained even more. The healthcare system has been challenged during the COVID-19 pandemic. There are three major hospitals in the Bahamas, and they are the Princess Margaret Hospital, Doctors Hospital, and the Rand Memorial Hospital. We found that the Rand Memorial Hospital had not fully recovered from after its major damages that it had occurred after the Dorian hurricane. So that even made it even strain more. Inadequate supplies and equipment. There were limited supplies, and there still continue to be limited supplies and equipment in our hospitals. Say, for instance, ventilators. There are a limited number of ventilators, and there was a struggle for the government to get more ventilators into the country, as more bigger countries were buying them in demand, and smaller countries were being left behind. There were inadequate facilities. The government of the Bahamas found itself having to rent extra facilities to help to manage the control or to manage the healthcare of the COVID-19 patients. Mainly in Nassau, they rented the Doctors Hospital Blake Road facility to house people that are terminal with COVID, as well as in Grand Bahama, I think it was the Sunrise Medical Center was also contracted. The hospitals had overcrowding in them. They were overcrowded. There were not enough beds even before COVID. And here it is with the impact of COVID having so many people requiring healthcare and hospitalization, it even became more crowded. There were international aid organizations that came to our aid and helped to set up mobile healthcare rooms or hospital beds in the parking lots of both Grand Bahama and Nassau. The healthcare system became compromised. It's compromised in that because of so many persons being ill with COVID-19, that normal persons coming in for other illnesses like heart attack and hypertension and all those different stuff, that they were complicated and that they may not gotten the service that they needed because the hospital was just so full and there were no beds available. The healthcare, the Bahamas had already suffered a shortage, was suffering, going through a shortage of nursing care and doctors. And here it is, during the pandemic, these doctors even became even more overworked. So we had that problem also of doctors being, healthcare workers being overworked. Nurses having to work double shift, doctors being very long shift just to help to manage the pandemic. The second point I would look at is called tourism. Tourism, we found that overall tourism had a big blow during the pandemic. There was decrease in visitors in the entire Bahamas. Hotels were forced to close its doors simply because tourists were not coming. And when tourists don't come, it affects the Bahamas even more. Cruise ships were not allowed into the country unless for servicing or to get needed supplies from a distance. Airports were closed. They were closed because there were times that our airport did not allow any traffic into the country, all in an effort to keep the Bahamians safe from COVID-19 coming into the country or being spread even more. Then there was the impact of COVID testing, persons needing to test so many days before they can travel. And then there were health visas that needed to be approved. All of these things complicated tourism and caused the numbers in tourism arrival to actually drop tremendously. The Bahamas government was already faced with a challenge of getting messages out to the world that, hey, after Hurricane Dorian, tourism was at a null. They had to go out with campaigns to say, look, the Bahamas, we still open for tourism. All of our islands were not affected. It was only Grand Bahama and Abaco. We're still here. We're open for tourism. And then came the pandemic that even gave us a more serious blow. The next point is employment. Because of COVID and tourists not able to travel, being our big, the biggest part of our economy was tourism, employment. Unemployment numbers increased. Workers were laid off, jobs made redundant. The middle class now are lower class as far as they're scrambling to make ends meet. Commercial activities almost came to a still, where you had businesses closed, lockdowns, had businesses closed, no commercial activities. Banks were open for only a few hours a day and with long lines. We saw that unemployment in 2018 was 10.4%. In 2019, it was 13.5%. And up to today is 25% unemployment in 2020. Increased cyclical employment happened. By May 2020, approximately 13% of the labor force had filed for unemployment at the National Insurance Board. That is a very high number. As you know, most countries only have about 4 to 5% unemployment. And to be suffering this high rate of unemployment was a real strain on the Bahamas government. Persons not being able to pay their rent, persons not being able to feed themselves, needed assistance from the government. Then there was a social impact of COVID-19 on the Bahamas, national insurance and social service being the two main ones. So you had national insurance had a big part in managing during the COVID pandemic unemployment checks, issuing unemployment checks, the approvals of these checks. $118 million in unemployment benefits so far was spent by the government via NIB. 13% of unemployment benefits continues even today. So several persons, even though we're a little bit better and things are starting to pick up, we still have a large amount of persons that are on unemployment benefits. Then there's the social services aspect of it. There were no new services offered by social service during the pandemic or during COVID-19, but they found that their services were requested more, much more than before. There were food assistance increase, rental assistance where persons who were normally able to pay their rent, were not able to pay rent and mortgages. Banks actually gave concessions or gave 6 months payment off, that sort of stuff that helped with the economy. Then there was, because of all of these things going on, there was high levels of stress in the society. Stress that came from lockdowns, anxiety, curfews, long lines, counseling had to be increased in many aspects. And there was, of course, grief counseling because of the large numbers of persons that were dying due to COVID-19. Education. Education saw a drastic change during COVID-19. There was the implementation of virtual school, even though the Ministry of Education already had virtual school that were being offered to mainly the students in the northern Bahamas that were affected by the Dorian hurricane. Now they had to look at it at a bigger scale. That was just a small department within the Ministry of Education that dealt with those islands. Now it had to be on a bigger scale. So now there's virtual learning where added much more stress was added to the learning environment simply because there were simple things like not having internet access at home, students not having access to portable devices to get access their learning products. Teachers needed to be retrained on new systems to deal with virtual learning, and there were new learning systems totally implemented. There's continued to be a challenge in dealing with the virtual school. There needed to be, or there were investments in tablets and new internet-based devices that to help the needy students, and there was a lot of service groups that came forth to help the needy in dealing with those sort of stuff. Challenges are still out there. We're trying to get the numbers for the virtual schools up. There are still a high amount of students that are not actually in school. They're not attending the virtual schools. These numbers will be addressed more in details during the written paper of my presentation. Then there was technology. Wow, the world came to a standstill. Nobody was moving, nobody doing anything. Commercial activities are still, but here it is. You still have to find a way to push and to get the economy still vibrating. There was increased use of technology in the workplace. You found even governments and companies, well, you found that there were large amounts of sales for laptops and tablets. But now companies had to look and the government had to look at equipping their staff to work virtually or remotely, working from home. So remote work with aid of technology increased. So persons now had to been able to, companies had to set up systems to allow their VPNs, to allow their workers to be able to work efficiently away from the office. Cashless systems became more prevalent. You find that the banks were not encouraging in-person banking. They encouraged ATM banking or online banking. And then the ones that did do it had long lines. So most persons reverted to online banking. There gave greater efficiency to a certain extent with the online banking system. Innovative ways of using technology had to be made. Companies, schools, businesses had to decide on how to be innovative on how they can still work through the pandemic and make a profit and be efficient. Increase internet activities. We find that with the cable providers, the ISPs, that there was increased internet activity and sometimes it was challenging where we had a lot of downtime where internet signals dropped because of the load of persons now requiring internet service on a daily basis. Systems needed to be updated and were forced to update. Governments. New COVID-19 policies had to be put in place by the government. The government had major challenges of trying to keep the economy even steady, even after going through a major blow like Hurricane Dorian. Lockdowns were put in place. There were lots of rules, regulations, hours when businesses could be operating. There were curfews. There were COVID-19 protocols put in place, hand washing, sanitizing, social distancing, and vaccinations. Companies were required to have certain things in store on entrance in the stores. Then there were travel restrictions, which included testing, health visas. Then the government actually um, did some business support funds where they gave some funding for small scale businesses. Then there were unemployment funds that they continue to assist with. And the main burden of the government is to try to manage the economy and continue to manage the economy even as we stay our way through this pandemic back to normal. The Bahamas is still not where it was before the pandemic, but we're very close to the numbers before the pandemic. Government produced several different strategies that they approach in phases. We had phases where we went from one phase where we had expanding operations straight down to beginning the normal, moving forward, and then actually the last stage where we were trying to reopen and opening tourism back to the country. So everything was thought. Government had to go to the board and decipher and decide on the product policies to maneuver our way through this pandemic back to the new norm. As far as economic, there was a decline in real GDP. Managing the economy is a major issue. Tourism, another major issue for the Bahamas, as is our main breadwinner. The Bahamas is expected to record an economic contraction of 12.5% for 2020. The fraction of whole households reporting earnings below the minimum wage more than doubled between January and April 2020. The fiscal stance has been severely hindered as a consequence of both Hurricane Dorian and COVID-19. A lower trade balance will support a wider current account deficit, projected to reach 12.1% of GDP in 2020. Gross international reserves remain adequate, reaching 2,033.9 million in April 2020. The Bahamas is the Bahamas is a resilient nation, and we have seen major hurricanes. We have seen recession, and the Bahamian government has worked through them. I am sure that the Bahamas government, along with its people, will continue to push towards bringing our country back to where we need to be before. I thank you again, and I look forward to presenting my paper to you, which will include more detail on figures and statistics to support my presentation. Thank you.